Good question. So the notch, of course, is represented on the screen, in this case by that green dot.
Right.
Right, so it depends on what I'm trying to do. What I almost always try to do is have that coincide with the way I'm moving,
Okay.
so that the screen isn't going one way while my transducer is going the other. That makes my brain explode. So so you probably need to go a little deep. You're trying to see glenohumeral, right?
Yeah.
We're going to go just a bit deeper. You'll like that better. Now, as you saw here, because I'm right-handed, I tend to like to come in from right to left with my needle, but I don't do that exclusively.
And you hold the probe with your left
Yeah,
hand?
generally. I can do both, but most often I will try to do left-hand probe. And
So I guess you started back here.
a little bit. So you're in the belly of the infraspinatus. So keep coming laterally. Yep, you got it. Now, stop there. You can see the glenoid.